vision for digital health in Europe is very promising. It is very important to make aware politicians and policymakers that we need a European framework where politicians are committed to the digital health structure. Making digital health successful is a matter of empowering the self-management condition for patients, empowering healthcare professionals to be in contact with patients and work together to improve patients' lives.
For IPOPI, which is the International Patient Organization for Primary Immunodeficiencies, our understanding of digital health is that digital health will provide, through better communications and technologies, an improved access to early diagnosis and care for patients suffering from rare diseases such as primary immunodeficiencies. And we believe that the future of digital health will enable patients to actually have accelerated access to their diagnosis and their treatment through the better utilization of data, notably through artificial intelligence or registries. And this will contribute to them ultimately having improved quality of life.
With the UEHP, European of Private Hospital, we developed the concept of a smart hospital, meaning communication useful for patient and professional. My vision is to develop communication offering the best quality of care and offering to efficiency, meaning the right solution at the right moment for patients.
For us, the digital health and care refers to products and solutions that empower, that make possible the prevention, the diagnosis, the treatment, the monitoring and management of health and lifestyle. We believe that digital health has the potential to make healthcare more democratic. It changes the relationship between the doctor and the patient.
The vision for EHMA, the European Health Management Association, for the future of digital in Europe is to establish an enabling platform, really. So all citizens, users, patients can make the best benefit of health services.
Well, the vision of digital health in Europe for nurses is a reality we cannot escape anymore. It's so much in the core of our professions. And if you look at our organization representing a lot of specialist organizations like intensive care, you got dialysis, you got rheumatology, but intensive care, the whole IT and the whole virtual, the whole technology is so much in the heart of their today's practice, and this will expand more rapid than many of us will realize.
From EHMA's perspective, the challenges of delivering health, digital health, are also the opportunities of delivering digital health. That is that they're really wide-ranging, they're really complex, and that they require all stakeholders to come together in an aligned way with a common vision and a common mission about what e-health is able to offer. And that splits really into pre-existing improvements, what we sort of term Health 1.9 changes, as well as those that are sort of blue sky, the new horizon, Health 2.0 opportunities.
The major challenge is to offer a solution dedicated to patients, but including the workforce. We have to enhance formation in hospitals, but we have to integrate the cost. The cost of new technologies must be absolutely necessary to include in tariffs and to develop innovative solutions.
For EPOPI, existing solutions that we have been working on in recent months or the past couple of years. Firstly is the launch of a patient companion mobile application called PID Genius. And this is an app designed by PID patients for PID patients, which enables them to actually monitor their health in a much more optimal manner by managing their medical appointments, but also by providing the tools to monitor their daily symptoms, their daily quality of life. And ultimately, this is a tool that can also serve as a purpose to better inform their medical experts, as patients will have the option to share some specific set of data directly with their physicians. And so we believe this is an example of an innovative digital tool that can be very helpful. We've also been investing our efforts in digital educational tools. We have launched a series of educational webinars which are actually designed for clinicians working in the field, but also for patient group leaders from around Europe, but also beyond, from around the world.
What's at stake for the healthcare professionals that they feel confident with the whole digital health, with new technology, because that's also what the patients like. If the patients trust the nurse because the nurse know about the medication, they know about the diagnosis, they know about disease, then the trust is also transferred when the nurses are very capable in this technology and that they know about it. And on the other end, nurses need to know and also to be curious what's going on. And that's not at the end of their career, but just right at the very, very start.
Today, digital health is very much in the realm of vision, in the realm of potential, in the realm of the future, but we have not yet tackled, we have not yet seen digital health being widely deployed in Europe. Even in the most advanced regions in Europe, there are still major barriers. And I think I would call 3 barriers out that hold back the deployment of digital health. One is technical. For digital health to work, we need an infrastructure, we need backbones, we need IT systems on the regional or on the member state level where data is being shared, can be accessed by healthcare professionals and by the patients. We have some regions in Europe where this is already the place. In many more regions, we have not yet managed to tackle this. Where the infrastructure is in place, we run into issues of interoperability. Systems and devices don't always talk to one another, even within the hospitals, but especially between hospitals and primary care physicians. And patients can only rarely share their data with their healthcare professionals from their personal devices. The second barrier I would call maybe cultural, legal. There are several dimensions to this. I think we need to build better trust and acceptability among patients, among citizens, so that they're willing to share their data. Healthcare professionals traditionally have always kept the data of their patients in their own files. So a culture of sharing data, of connecting data and sharing it with other healthcare professionals needs to be built. And we're on a good way there, but we're not yet there. Finally, I think we have financial and commercial barriers. Today, digital health is very much a consumer phenomenon. People buy trackers, fitness devices, and other stuff that is connected, and they upload it to their private clouds, but they are not yet sharing it necessarily with their healthcare professionals because the systems are not yet in place. And so that's a technical barrier, but we're also not ready to deal with digital health from a payment or from a reimbursement perspective.
Diabetes is a complex condition. Putting together lifestyle conditions such as food intake, medicines, and physical activity makes it even more complex in terms of data and in terms of managing the disease. It is very important that we put all these data together in a structured way and to make the patient and the healthcare professional work together to make the outcome more effective in terms of healthcare and at the same time of patients' involvement.
Digital health is about providing patients and also physicians with solutions that will ease diagnosis, follow-up, and also the comprehensions of the diseases.
When it comes to what countries and national policymakers can actually do to contribute to better access to digital health, I think the first line of action is trying to make sure that we harmonize the way data is collected and the way data is registered. With the recent launch of European Reference Network across Europe, I think we will have the appropriate platform to achieve this goal. And secondly, I think that countries can try to make efforts to ensure that patients are more involved in the decision-making process around digital health, knowing that patients are often the instigators of new e-health digital tools themselves. So making sure that they have a support framework available at the national level will be very important.
We are absolutely convinced that a big chance for the future is to have medical data and to analyze them and to coordinate care using this data. Nevertheless, including information and cost, we are just asking for this innovation substantial budget adaptations.
We at MedTech Europe, first and foremost, we need to keep in mind that digital health is about data that has the potential to save lives. In that regard, we're really interested in a balanced regulatory environment. We're looking these days at the ethical guidelines for artificial intelligence. We're looking at the GDPR that is now being implemented in member states. We're looking now at a new initiative to make rules for cybersecurity. And in all these, we support the respect for privacy. We absolutely endorse the need for cybersecurity. We want AI to serve humans, citizens and patients, but at the same time we need to make sure that we keep in mind that this data can save lives, it can transform lives, and that we need to make sure that we can actually achieve something with digital health. The second point that we have is we very much want to see more and better cooperation between the European Commission, the European institutions, and the member states. Healthcare, as we all know, is a shared responsibility, and member states have the prerogative for the sovereignty for delivering healthcare services. But if we want to reach scale in many instances, we need to have good cooperation.
The nurses today, those in specialist areas, in advanced position with higher responsibility, very much need support from the national regulators and health professionals of health policymakers to improve their digital skills.
Policymakers within Europe, they could set up frames that are strong enough to preserve privacy, but also allow research and international cooperation.
For Emma, what we're observing in terms of being able to realise the benefits offered by digital at a national level and a European level is really around health systems. And what national governments, what the EU can best do is to be able to level the playing field. It's about interoperability, it's about issues such as health literacy, it's about being able to get skills and competencies across a broad range of stakeholders. So looking at those health system challenges to allow all the various initiatives that are developing to reap best benefits.
For politicians, we ask political commitment. From the European Union to the member states, what we are demanding is to have a joint structure, and this strategy will come from the European Union to member states implementing national plans. Political commitment is very important, not only to develop a policy framework, but to allocate the resources and budget needed to make it possible. Our vision for digital healthcare is monitoring and self-care.
Connectedness.
Patient-centered digital health.
My vision for digital health is patient safety.
Quality of life, this is the ultimate goal.
A platform to connect and empower.
My vision for digital health is a reality we cannot escape from anymore.